All right, we're going to go ahead and get started. Let's see, 1, 2, 3, 5. This is what I said. 5 people are going to come. This is great. So, the people are still coming? You know what I like is that you're identifying what your needs are and pulling together resources to take care of yourself, and that is some good bereavement practice. Good for you. There's actually a big debate in the bereavement world about whether or not you should hand people tissues. Yes. So here's the thing. This is actually an interesting debate, because here's the thing. If there's tissues out, that's great, because you need tissues, right? But if you hand somebody a tissue, on some level you're saying mop it up. If you hand somebody a tissue, people tend to stop crying because they are suddenly aware that other people can see them crying, and they tend to put the feelings back down. And with grief, we generally want the feelings to come out. And so the idea is that you should be thoughtful, if you can, and make sure tissues are in arm's reach of people so that you do not have to hand them a tissue and risk inadvertently communicating button up. Yeah, that's very thoughtful. People like their oh, here come more folks. Excellent. Hi, welcome. Welcome. Good to see everybody. Come on close to the front unless you're a back of the room kind of person. I respect that. I wasn't cool. Some people are. I get it. All right, this looks like a good number of people. We can go ahead and get started. Hi, everybody. My name is Abby, Dr. Nathanson. You can call me Abby. I am from New York. I am a part-time faculty at NYU, but my whole practice, I have a private practice for therapy and consulting, and I work exclusively with people dealing with sort of the intersection of trauma and illness and loss. And so not the people who are grieving and sort of doing okay, but the people who are grieving and deeply struggling and stuck and overwhelmed and disintegrated. You know, these are my people. You are my people. And so what we're going to talk about today are the losses specific to prion diseases, right? Because there's some elements of grief that are universal, and we'll talk about those, but there are some ways in which the nature of prion diseases themselves drive the experience of the bereavement. And the third piece that sort of comes into this is, what does it mean now to grieve coming out of a major pandemic, right? Because there's so many losses that happened during the pandemic that change the ways in which we grieve and connect. So we're going to talk about all these things. My plan is to talk for about 35 minutes and leave about 20 minutes at the end for questions and discussion. I know in a lot of these community discussions, folks are sharing a lot of their personal experiences, and I'm certainly happy to hear and hold witness. But specifically, if people have questions about the grieving process or ways to address things, you know, this is a great forum to talk about those things. So this is a quote from one of my favorite patients. They're all my favorite, it's true. And she said to me, and this might be a thing outside of what she said, this might be sort of in the grief piece in general, she said, everybody dies in the middle of someone else's story. And she actually said to me once, she's at this place in her life where everybody she loves has died. And she feels like there are more people in her head than there are in her world, right? And so when she talks about her grief and she talks about the idea that everybody dies in the middle of someone else's story, it's an awareness that all these people that she loved, and she is still living, her story continues. And her story includes all of these other losses and all these other things that she's been through in her life. And I thought that this was just a poignant reminder, right, that all the losses that we experience are in the middle of our stories, right? And when we die, we will be in the middle of other people's as well. And just recognizing the interconnectedness of these legacies of loss as we're going through. And I'm starting with this quote partly because she's very wise and brilliant and says things in really catchy ways, but also so that we can check in with ourselves. As we're talking about bereavement, some of our discussion will be cerebral. It will be an idea of what does it mean to have a bereavement theory or a paradigm or an understanding of symptoms and things like that. And sometimes you'll be in sort of a felt sense of the bereavement, right? So I will say something and you will just be sucked into your head, into your heart. You'll have a wave of grief sometimes and remembering a certain kind of experience, and you might come in and out of those two places, and that's okay. Right? So I just would encourage you to notice as we're going through this. I'm a somatic trauma therapist, so I'm very much about where are we holding things in our bodies. As we're going through this experience of bereavement, to notice, when am I present with my mind? When am I sort of in the past and thinking about something that happened before? And when am I feeling how I'm feeling right now? And what kinds of things are moving me in between these different states? And to notice this with compassion, not with judgment, not with an idea that you're doing anything wrong, but just to notice the way that your nervous system, your autonomic nervous system, is interpreting different things as threats that you can stay present for, things you need to mobilize against, or things we're freezing ourselves against. So there's sort of a couple different ways that we're going to understand grief. A lot of these are similar slides to any of you who saw the presentation that's online that I did sometime last year, but I'm going to sort of try to bring it from a couple of different angles. And the thing to understand with losses is that we have an evolutionary an evolutionary drive to grieve, right? If you think about a baby in some hunter-gatherer society, a baby can be without food and water longer than it can be without protection, right? A baby left alone in the woods will get eaten by a bear, within a couple of hours. It can survive without food for a couple of hours. So we have an innate drive on some level to want proximity. We need proximity, we need consistency in order to feel secure, right? In the absence of this attuned caregiver and this connection, we go into this mobilized state, right? This autonomic system of a fight or flight state because we are fearful, this mortal agony of separation. And so in many ways, when we think about grief, we can think about this as a prolonged state of separation distress, separation anxiety. What does it mean that this thing that made me feel safe in the world, I understand how the world made sense and who I was, it is gone, and my mind is saying I'm okay and I can still take care of myself, but my body is feeling this mortal danger. And in many ways, we can understand grief as an extension of this attachment rupture, this relational rupture. And so when we're looking at grief, we're not just looking at what did we lose on the outside, we're looking at what did it mean to us to have lost this thing. And this thing could be a person, it could be a relationship, a future you thought you were going to have, a life you thought you were going to have, all these different things. And it's not just, am I looking at who did I lose, or what did they mean to me, and who am I without this person? Who am I in a world in which this person does not exist, right? And so when we're understanding grief, we're understanding both the nature of loss and the nature of the grief. And those are not the same thing, right? The nature of the loss you all share. The nature of the grief is going to be specific to who you are, to what you've been through in your life, to your temperament, to your family, to your circumstances. So your losses may be ambiguous or they may be concrete. Concrete losses might be the day that somebody dies. The day that somebody dies is an identifiable time, right? There's a day of death. There's a day they are alive. There's a day they are dead, and you can name it. And for the purposes of grief, other people can name it. Other people can say, oh, your husband died this time last year. Here's a casserole, whatever your culture's version of a casserole is, right? These are nameable. When the losses can be named and seen, both by you and by other people, you have a chance to heal, to connect. So many of the losses that you have with neurodegenerative diseases and with prion diseases are ambiguous losses. They're the losses where the person is physically present, but they are psychologically absent. They look like the person that you know, but there's not that shared connection and history and relationship and attunement. And so you're still going towards them with whatever love and relationship and connection that you have, but you are not getting back. And intellectually, you might recognize this, but think about what this does for our sense of loss. When do we lose the person? Do we lose them at the first time there's a symptom, and we're like, something's different? Now everything's different, right? It's the beginning of lots of little losses. And because there's so much caregiving and so many things that change and so many things to do in such a short period of time, we could not begin to name all these losses if we tried. And so our losses can be both ambiguous and they can be concrete, and the nature of whether the loss itself has nothing with us, whether the loss itself is ambiguous or concrete, will drive our individual ability to name it, understand it, metabolize it, connect around it, heal from it, carry it. Losses can be physical and symbolic. We can also think about losses in a temporal sense. So losses can be anticipatory, pre-death or post-death. An anticipatory loss, anticipatory grief, is grief that you are feeling now for something you anticipate later. So it's not the anticipation of grief. If you are anticipating a loss later, you're already grieving it. You're already aware of the space that is taking up in your life. So anticipatory grief applies temporally to when you expect to experience the loss. The grief is happening right now. Within that same temporal time frame, we can think about losses that happen pre-death and losses that happen post-death, right? A lot of times we think about loss as only when the person died and then how do you recover. From the moment that there is a symptom, you begin to grieve because your world has changed. Something is different, right? And I recognize as I'm saying this may be bringing some of you back to your experiences of illness, of diagnosis, and all that process. So just take a moment when you need to and just honor the space that is taking up for you right now, right? And come back to us in your head whenever you need to. The last way that I want us to think about understanding losses and grief are disenfranchised and acknowledged. Some losses are acknowledged. The death is almost always acknowledged. Somebody else will say, yes, this person died and that matters and your grief matters and this is important. Some of the losses are disenfranchised. Some people miss caregiving. They say, how can you miss caregiving? It was terrible. You were up all night. You were so stressful. It was so stressful. How could you miss it? You should be relieved. You don't have to caregive anymore, right? Most people who are caregivers feel some measure of love in that caregiving, even when it's stressful, even when it's overwhelming and frightening. For many people, it is an expression of love or some other value of obligation or meaning. And so the loss of caregiving sometimes can be a disenfranchised loss. And disenfranchised means the people around you don't necessarily understand or recognize or hold space for what it is that you lost. And so you sort of turn inward with it, right? And the piece of all this to think about is that what you need to heal from grief, 103 billion people, this is a made-up number, there's somewhere a number, 103 billion people have ever existed. Almost none of them had a grief therapist, right? What did they have? They had religion, they had communities, they had culture, they had societies, they had family, they had the seasons, they had nature, they had something else to remind them that they are part of something bigger than themselves, right? Grief therapists are great, I love us, right? And most of the time to heal from grief, what you need is to be part of a community, to recognize that you are part of something bigger than yourself. And so when your losses are disenfranchised, when they're not acknowledged, it's harder to get that sense of connection. This is the same thing that happened during COVID. A lot of people lost the ability to feel like you're part of, you don't have the rituals, you don't have people coming together, so your losses almost become disenfranchised in that sense. And you don't have to worry about turning this into definitions, like am I in this category, that one, but just to recognize the different ways to approach and understand the spaces of loss that we have inside. As we're going through, because I am a somatic trauma therapist, I'm always going to have us sort of checking in with your own experience in between. You are welcome to check out while we're doing this. If you don't feel like dropping into your bodies right now, always okay, but these are questions you can be asking yourself to check in. So one of the things you do with your grief is to recognize the fact that you are grieving and to meta-process the fact that grief exists in your body and in your experience. And this might be intellectually something you're aware of. But what happens if you ask yourself, how do I feel about my grief? Am I mad at the fact that I'm still grieving? Am I worried about it? Am I sad? Does it feel like a badge of honor? What does it mean to me that I am grieving? Does this feel like the way to hold on to a connection and I'm scared to let it go? Does this feel like something that is taking away more from me when so much has been taken already? We have all sorts of meanings and feelings and things about grief. And when you have the chance to sit there and just notice, how do I feel about my grief? How do I feel about the fact that I'm grieving? What does it mean to me in the context of all the other things I've been through in my life and all the other things I want to accomplish? How do I feel about it? And notice with gentleness and compassion how you hold that space within your body, because the narrative that you have about your grief has a lot to do with whether or not and the ways in which you let yourself be taken care of in it. I will say for anybody who's in an acute phase of grief, I'm going to say like the first year or two, you may not have a sense of this. You may just still be in shock. What the hell did I just go through? What just happened? Fair enough. That might be how you feel about your grief. But just to recognize that that may change over time. How do I feel right now? You may notice inside how it feels to even ask yourself this question. Is there resentment at having to go here when you're trying to be in, receptive mode? Is there joy in being able to recognize it? Is there relief, right? Is there anxiety and fear? What if this comes up and I can't button it back up again? So just noticing how it feels to go towards your grief is part of your grief process. These are going to be, I'm touching on these briefly. These are my two favorite conceptual paradigms. And they told me I could talk about whatever I want, so you get to hear my favorite conceptual paradigms. And these are the ones that I think are the most organizing. And I'm leaving them up here, and they will be in the slides, so you can Google them later and spend more time on them. But I think that one of the thing to recognize is like when patients come to see me, they're seeing me for 45 minutes a week. They are grieving 24 hours a day, 7 days a week. They need some way to hold on to and organize their experience even when they're not in front of me. And I think one of the best things to do, and one of the things that I think a lot of rituals and societies do, is they help people organize their grief. So the most prevailing model of grief is a dual process model. The DPM is a dual process model of grief. You may have heard of the 5 stages and things like that. That is brilliant, but wildly misapplied. It is meant to people to understand elements of facing their own death, not the death of others. It's a whole thing. The dual process model of grief is encompassing across cultures, across genders, across ages. And it's a recognition that grief is not a linear process, which means people expect I grieve a lot, and over time I slowly grieve less over time. And because they have this linear expectation of grief, anytime they're thinking less about the person and they go back to thinking about the person, it feels like they're going backwards. They're doing something wrong. But anybody who's really been through this recognizes there's nothing linear. And not only that, it's not supposed to be linear. This is not how human beings work. We need repetition, we need proximity, we need consistency. We need to dose these things out. If we felt all of our feelings all the time, we would get nothing done. Our brains have to let us dose this out. And so the dual process of model of grief says we want to make normal and typical that there's going to be an oscillation. That some of your grief is what did I lose, how were things before? And sometimes this is joyful and happy and gratitude, and sometimes this is horrifying and sad, all the things in between. What did I lose, what came before? And some of our grief is what is it like to live without? And sometimes there is the relief of the free time, that I'm not on my phone all the time. I can sleep at night. I can turn my ringer off sometimes, right? These things can happen. Some of it's how am I supposed to pay the bills and figure these things out? How do I go through life when I can't call? Joy and sadness all in one. And so it's the restoration of needs and the loss of what you lost. And that what you will experience in your grief is you're going to go back and forth. And everything is forward, everything is iterative, everything is inclusive of everything you've been through. There's no going backwards. In this moment, I'm in loss, and in this moment, I'm in restoration. Around an anniversary, I'm going to go back and forth 100 times. Around a holiday, birthday, whatever it is. That was very loud. I'm going to go back and forth 100 times. Right after a loss, over time, I might spend more and more time in restoration, and that's okay. And there might be times when I'm struck by a wave of grief and I don't know why. I'm walking down the street and I smell the hot dog cart. I'm from New York, we have hot dog carts. And I remember something and I have a wave of grief and I'm back in that loss and where things were. And a few minutes later, it seems like it passes and I'm okay again, right? Normalizing this oscillation between loss and restoration is probably the best thing. If I could do anything to put myself out of a job, it would be to convince people that you are not crazy for however you're grieving. It's probably fine. So the dual process of model grief is that it's okay to avoid your grief sometimes. It is necessary. It is okay if you spend weeks never thinking about your grief. It is okay if you spend weeks only thinking about your grief. Right? So the dual process model is that flexibility for that oscillation, which I think is really helpful. The other one is based on the polyvagal theory of the central nervous system and the ways sort of mechanistically in which we acknowledge and process threat and safety. This is sort of a two-line summary of something that could be encyclopedias full of things. But just to recognize within ourselves, when I'm in a grounded state, I am connected, I am relationally attuned, I can take in, I can be curious, I can be compassionate, I can take in things around me, and think we sort of know when we're in this grounded state. When we perceive some threat or danger, our bodies mobilize into hyperarousal. In hyperarousal, I'm tuning out everything except for the threat. That's when I lose out on the ability to empathize and connect with other people, to take in from other people, and I'm just focused on the task at hand. This is when we are ruminating, we are getting things done, we're figuring stuff out, and we're in problem-solving mode. For people who are caregivers, you are in this state for probably years, before and after, during and after. It is very hard for your nervous system to understand that you do not have to be spinning like this to keep somebody alive anymore. This is one of the hardest parts. After hyperarousal, if we get so overwhelmed, we run out of the ability to process, we cannot fight or flight, we go into dissociation, hypoarousal. That's our parasympathetic response system kicking in and saying, we need to numb ourselves. This is too painful. I'm going to numb myself, I'm going to release endorphins, I'm going to do things so I don't have to feel all the things. And it is perfectly normal and natural and expected that you're going to go in and out of these states all the time. What happens with caregiving is there's such a prolonged state of stress and distress, whether you were caregiving for a couple of weeks or a couple of years, whatever it is, right? It is so hard to move out of it, especially when the state of being in caregiving is to keep somebody alive, to figure out taking care of somebody, to manage whatever's happening, right? It is so hard to tell your nervous system, come back down again, right? And so the window of tolerance is something that I tell people to learn how to track your nervous system, know how it feels, not with judgment, just with compassion and understanding. When do I go into hyperarousal? What are the cues that are likely to put me back into this mobilized state? When do I get so overwhelmed by that, I just freeze and I start just going through the motions and numb out, right? And recognizing that it's okay, our nervous systems are healthy when they can move through all these states, and when we get stuck in some of these states, it's a good time for help, to get an extra layer of help. So one of the questions when we're looking at our grief is, when did my grief start? Grief does not start at the moment that somebody dies, when you're dealing with a neurodegenerative disease. For many people, the grief might come if there's some familial component, right, when somebody else in your family gets it, and then my life is totally different. For most people, it's whenever there's a symptom, a diagnosis, a test result, something confirmed. There's usually some moment where it clicks. Everything's different now, and nothing will ever be the same again. There's a before, and there's an after, and now I'm in the after. And I don't know what it looks like, and it sucks, and I don't want to be here, but there's an after. And recognizing that that is when your grief started. That is not when you got to have time for your grief. That is not when you had the bandwidth to process the fact that you were grieving, but that was when your grief started. That was when your life changed, right? And again, overlapping with all the other things happening in your life. It's not like everything else in your life just stood on hold while you were grieving. But recognizing and holding space for the fact that your body has been grieving since that moment, and many people can identify the moment, some people can't, totally cool. That moment, nothing's going to be the same again. So this is the piece that I'm putting up here not to bum you all out, because you all know all this, but to honor and hold space for all the things that you've already figured out how to deal with. And to recognize the enormity that if you are emotionally and existentially tired, there are a lot of really good reasons why. And when you're saying to yourself, why can't I just? Or why aren't I already? Right? And there are losses that are specific to CJD we'll just say there's an umbrella term for all of them, right? That are have some overlap with other neurodegenerative illnesses, some lap with other illnesses in general, and some that are specific to your community, to this community of people, right? A lot of times, I'm going to go through them sort of briefly and recognize that for some people, some of these might hit home. For some people, it might be like, oh wow, I didn't realize how much I was really dealing with. But I encourage you all to notice, as I'm reading through the losses, what happens to you inside when you hold space to honor what it is that you lost. I'm looking at your faces now, and this is hitting folks hard. And so I just want us to take a moment and honor the fact that this is very painful and very tender, and you're in a room full of people who get it. Okay? Some of the losses of CJD are your roles and other milestones, the life you thought you were going to have. When the loss happens, especially out of life cycle, right? When somebody dies at 95, it's always different than if they were dying in their 40s or 50s or 60s. The person as you knew them before. Having to take on the role of expert, right? When you have to be the expert, you lose that sense of being taken care of. There's a vulnerability in that. Even if you're a healthcare provider, you don't know this stuff, right? The ability to have control, or the illusion, the fantasy that you might have had at one point that maybe you had control over things, predictability about things, security, connection. All of these things get threatened in ways that's hard to identify because each little thing is one day, one doctor's appointment, one test, one advocacy, one phone call, one pill, one this, one that, right? But it all goes up to, what does it mean if I can't control all the things, right? The connections that you had in your life before who don't get it, who love you and support you and show up, and often probably say stupid things, however well-intentioned, right? Where you have to interpret, God never gives you more than you can handle. Oh my God, please don't say that to people, right? Take in the love, hold your distance. Your existing connections get fatigued because this goes on and it's so much. Your relationship to your higher power, right? There are a lot of people whose faith is severely challenged by this experience. There's some people who can lean in, and there are some people for whom they don't know how to connect from a world that doesn't make sense in this way. Your faith in healthcare, right? Severely challenged. Income, career, and time to grieve losses. This is true for many caregivers. There's so many things to do. There's not always time to heal and to recognize and hold space for. We keep ourselves sometimes in this state of hyperarousal, this activated state of the central nervous system, because we lose relational attunement. We don't feel the losses in hyperarousal. When we come out of hyperarousal and we have to sit and be present, it's like, oh shit, I'm gonna curse. Oh shit, like what did I just go through? In some ways, then we want to jump right back into, let me just fix and do and run around, because then I'm in a fight state, right? Or a flight state, at least I'm doing something. So for those of you who are having reactions right now, for whom this is naming or organizing or validating part of your experiences, you may want to participate in this part. For other folks, you may just listen with your head. Where do I hold my grief in my body? Emotions are physiological states that we apply some thoughts to later, right? They all have an evolutionary function. Where do I hold my grief in my body? And in this moment, some of you might have an immediate answer. I can feel it's an elephant on my chest. It's a sharp pain in my stomach. It's a weight on my shoulders. For some folks who've had to be checked out of their body for a long time, you might not have an immediate answer for this. That's okay. But starting that practice of checking in and honoring where it is in your body. One of the things you can do when your bodily sensations feel like a lot and your body feels like it's holding on to a lot is to take your hand and put it on the part of your body that is holding it and just breathe into your hands, right? And this has one of the effects of slowing down your sympathetic responses. And on this more spiritual level, breathe some air and love into the ways in which your body is holding on to what you went through, right? Where do I hold my grief in my body is a great way to sort of check in and regulate and honor what it is that we hold on to, and it's a great way to pull yourself out of this hyper-aroused state. Many people cannot tolerate that for long periods of time without practice, especially if you've been running around for a long time. So be kind and give yourself grace if you can do it for a moment. If for a moment you can tell when you're feeling it in your body, great, okay? This one I'm going to touch on a little more briefly just to be able to get through some other parts, but you can certainly come back to it. But there's a lot of struggles of CJD grief that are unique to this situation. And again, naming these to recognize, if they're hitting you hard, the enormity of what you've been carrying and what you've been going through, and to honor that, right? I'm not going to read it out loud just to give people a chance to check out of it if they need to, but if you want to read it and soak it in, you certainly can. This is one of my favorite questions to ask people, especially caregivers. I always want you to ask yourself every day, especially folks socialized as women, what can I be doing less of right now? What can I assume less responsibility for? Can I be blaming myself less? Can I be focused on other people's needs less? Can I hold the shoulders up by my ears less? Can I give myself fewer expectations of what I should be doing in this moment? What could I be doing less of right now? Because for so long, doing more was an act of love. And now when you take care of yourself, you ask yourself, what can I be doing less of? And so these moments when you're running around, what can I do less of in this moment? Right? And maybe it's just holding my breath, letting yourself breathe, right? Maybe it's saying no to something you don't want to do, but you feel an obligation to. I hope it's a self-judgmental voice that's telling you should be doing anything other than what you're doing. I hope you do less of that. But asking yourself that question, what can I do less of in my grief? What can I allow myself to feel and experience? These are my hope it makes a dent in your grief suggestions for how to love on yourself. Name what you've lost. Name it to yourself, name it to somebody else, name it to your higher power, name it to a cat. Whatever is meaningful for you, name it. Give words to it, give voice to it. Maybe you write it down and then throw it in a fire, but let it be seen, bear witness to it. And think about holding it lovingly, not just the person, but what it is that you lost. Hold it lovingly. Be kind to yourself about how you're coping, right? The joke that I tell my patients is meth and murder. If you are not using meth or murdering people, you are probably coping okay. Give yourself a very wide berth for almost anything else. Sometimes people are coping by doing, and sometimes people are coping by feeling, and sometimes people are coping by not feeling, and sometimes people are coping by throwing themselves into something. And just give yourself a really wide berth that this is hard, and it is okay that it is hard, and be kind to yourself about how you're coping, right? If you're mostly taking care of yourself, if you're mostly showering and mostly eating and mostly being fed, and the people in your life are mostly healthy, then you are doing fine, right? And I'm not saying you're happy, I'm not saying you stay in that place, but don't beat yourself up. Be kind to others who will not show up how you need them. I'm sure this relates to all of you. Or to people who cope differently than you do. If you need to talk about the loss in the person all the time and somebody else needs to never talk about it, be kind to each other. These are two very valid ways of coping. Look for opportunity for imperfect connections. One of the hardest things we do is when we are in this fight or flight mode, we look for safety. And so somebody comes along and they don't jive with what we're going through and we want to push them out. They didn't call, they call too much. They offered the wrong thing. They're leaving me alone, they're not leaving me alone. They're saying stupid shit, whatever it is. I mean, if they're terrible, cut them out. But I mean the people who mean well but are just sort of awkward. Look for opportunities for imperfect connections. No connection is going to fill the hole in your heart. That does not make them a threat. You still need them, right? So let people be imperfectly connected to you to the extent that it's good for you. Some people are toxic, fair enough, but most people generally mean well and are trying to give you some love. Let that happen. Recognize that while nothing will fill the hole, you can create a life worth living, even if it's not how you expected it to be. And sometimes the hardest thing, and I got this from, I'll have this on here, What's Your Grief? Which is they have like a book and a website and everything, and they had this on an Instagram post once, which is that sometimes the hardest part of grief is realizing that there's a life worth living outside of the one that you had planned. And so be kind to yourself if there's a life worth living outside of the one that you had planned. It is not a betrayal. It is a way to honor the fact that you are living. You got to live your life. Don't compare your insides to other people's outsides. I think this is from AA. I think it's brilliant. Everyone else is grieving better. She figured this out. She started dating again. He's going to exercise every day. Don't compare your insides to other people's outsides. Right? I will tell you, for somebody on the therapy side of things, I see people who on the outside look like they totally have their stuff together in life, and they're hurting. Everybody's a person. Everybody's complicated. So don't sit there and say, because I'm feeling this way inside and I'm not doing these things that other people are doing, I'm doing something wrong. Meth, murder. Otherwise, you're cool. Do not hold yourself to timelines and expectations for where you should be. It is not a thing. All of the research about prolonged grief disorder that says this is where you are at 6 months does not mean that you are done grieving at 6 months. It means this is the point at which the data shows that there is reasonable predictive value of a certain score in a test, meaning where you're going to be in 2 years. Nobody's done grieving at 6 months. It's not a thing. Not a year, 18 months, whatever else it is. There's not a timeline, right? With neurodegenerative disease, you lose the person in so many bits and pieces. Sometimes there's delayed grief. Sometimes it's a year before it even hits you, right? That's more common with like an Alzheimer's type, but there's no timelines and expectations for how you should be grieving. Let yourself have your feelings without the pressure of action. Well, what am I supposed to do about it? I can't do anything about it, so I shouldn't feel it. I should be over it. That's not helpful, right? Let yourself have your feelings. However you feel is however you feel, and that's it. It doesn't have to be reasonable to somebody else. It doesn't have to be something you fix or something you do. It's terrifying, it's a lot, but you feel how you feel, and you feel how you feel because of whatever you've been through. And delineate between behaviors have a moral judgment. You should behave in a moral way. There's no moral judgment to your feelings. You feel however you feel. Let yourself have your feelings. When you have a self-judgy voice, be compassionate with the self-judgy voice. The self-judgy voice is trying to help you and protect you with from something. So just be compassionate with yourself. This is a great question to ask yourself. I have patients. I ask patients this question, and I make them write it down on note cards and carry it around with them. And sometimes they have, if you ever see somebody on the subways on the streets of New York, and they have an index card in a Ziploc bag, they may be my patient. In my hardest moments, what do I most need to hear, know, and remember? Maybe think about the people or the thoughts or the connections that bring you the most comfort. What do you know to be true in those moments? Is it when I feel connected to God and I know that I'm part of something bigger than myself? Is it when I know that I'm surrounded by love? Is it when people reinforce and validate that this person really matters and they still matter that they lived? What do I most need to hear, know, and remember? Do I need to know that whatever I went through before in my life that is coming up right now, that's not what's happening now? What do I most need to know? Not what should I know or what should I think or feel. What actually brings me some measure of comfort? Write it down. Notepad, index card, Ziploc bag, carry it around. When you're thinking about getting more help for grieving things, these are just Abby's guides to considering what therapy and grief counseling and bereavement counseling can look like. So there's basically two ways that people get bereavement support. There's individual, which is one-on-one, like therapy and counseling, and there's group work, like bereavement groups and things like that. They're both brilliant. They both have a lot of research to support their efficacy. They have different indications. In individual work, if you have a complicated life and you've had a complicated history, individual work will give you more space for that. When you have complicated family dynamics and traumas and you have other things that are happening in your life, when there are impacts on your other relationships, individual places will give you the space to really look at the context and more deeply understand what you're going through in a way that you can titrate it according to what you can handle. In a group, you're going to get flooded and maybe check out a little bit if it's very overwhelming. And so that may not really get deep enough. When hearing other people's experiences is flooding instead of comforting, and that's true for most people at the beginning and many people throughout, when you hear other people's experiences, it's just like, oh my God, the world is a terrible place and nothing good ever happens, and you go into this place, you are meant for individual work. You get to have that one-on-one attunement and have somebody support you and hold space for you. That is what you deserve, right? Always one-on-one, when there's a risk of destabilization, when I cannot take care of myself, when I cannot meet my basic needs, when I'm at risk of psychiatric emergency, I need one-on-one support. A group is not enough. When there's prolonged grief disorder, post-traumatic stress disorder, active substance use, I'm going to say more abuse, or some impairing mental disorder, you need one-on-one. You need somebody keeping an eye and giving you that really attuned support. When you're trying to pick somebody to help you with your grief, bear in mind, many people think grief and depression are the same thing. They are wildly not the same thing, right? Depression is a disease, a multi-etiological disease with lots of different reasons why we have it, lots of different reasons to treat it, that is a distortion of daily life, right? Grief, you're sad because you're seeing the world pretty clearly. It's not a distortion. You're not thinking your way out of this. And so when you're asking, hey, can you help me with my grief? Everyone's gonna say, yeah, I treat grief all the time. The question to trip them up, how do you treat grief differently than depression? If they say they treat it the same, move on. The other thing that you want to ask your providers, how do they see goals? What do they see the goal of grief? Because the goal of grief is not less grief. Grief is a typical natural reaction to what you went through. How do you carry your grief? How do you integrate it? How do you honor it? How do you weave it into the rest of your life? Right? So they say, my goal is to fix your grief, so you're not feeling so much grief anymore. See if you have more choices, right? How do they see change happening in the grief, right? And this is, again, where we don't have a highly regulated system. So these are Abby's secret insider tips for figuring out somebody who actually knows grief. When you're looking at groups, bereavement groups to me are the best intervention for most people because you need a community, you need people who get it. That said, not every group is right for every person. Groups can be run by a peer or they can be run by a professional. For something like CJD, which is such a unique experience, sometimes people prefer peer because they want people who get it. That said, sometimes it hits so close to home, the narrative becomes kind of entrenched, and having somebody with a little bit of distance can be really helpful. So you can think for yourself which one makes sense for you. Groups can be open or closed. An open group means anybody can pop in at any point. A closed group means you have like the same 6 people showing up every time. You tend to be able to go deeper with the closed groups, right? Because people know each other and it's not just spending most of the time introducing yourselves every week, right? They can be short-term or long-term. They can be 6 weeks and you have it and you start 1, 2, 3, 6 and then you're done. They could go on for years. They can be organized by relationships, spouses, partners, children, whoever. They can be organized by illness. Or they could be mixed. And you can think about the group's orientation in terms of structured, where week 1 we were discussing this, and week 2 we were discussing this topic, and week 3 we were discussing this topic. Or they can listen for what we call emerging themes, which is people show up and whatever people bring gets sort of discussed and processed as a group, sort of whatever emerges. And there's pluses and minuses to both, like you get to pick. The groups can either be just for caregivers, just for people who are bereaved, or mixed, right? That's again a consideration for folks. The nice thing with bereavement groups is they are often free or very financially accessible. A lot of places run free bereavement groups. These are some additional grief resources. These will be on the PowerPoints. I'm not going to lie, I finished this on the train on the way down here today, so they are not in the thing, but you will have them afterwards. Some additional grief resources. These are some books. So I say there's this group that does what's called What's Your Grief? They have a website, they have a book. The book is fabulous. They have Instagram accounts if you're into social media, but the book I think is really good. And I will say for me, I'm a professor of grief at NYU. I'm very picky about my grief things. People get it. There's a lot of people who mistake folk wisdom for evidence-based practice. I think What's Your Grief does a really good job. These are some other books I think that are sort of grief-related that you may consider that may strike you. The thing with books, I very rarely recommend books because everybody has such a unique experience of grief. I don't want you to read someone else's experience and then feel abandoned and feel alone. And so to recognize what I say with grief is that there's 1,000 different ways to point to the sun, and they are all accurate. And you just need to find yours. And so if you go through 5 books and none of them resonate, maybe the 6th one will. Right? There's no universal book that applies to everybody for grief. You can call your local hospices for bereavement support, even if the person that you took care of was not a member. They help everybody. The CJD Foundation obviously has some great groups. Good Grief and the Doogie Center are both great resources for information and other groups. I will say I really like kids' books about bereavement a lot. I read it to my graduate students. I've sent these books to my adult patients because the books on bereavement for kids explain things in such a way that like our adult brains don't click in and it really gets at the heart. And so if there's some party that wants this for yourself, take a kid's grief book for yourself. And so these are a couple that I think are particularly well done. Ida Always will make you cry, but it is great. The Invisible String is not about grief necessarily, it's about sustaining connections and continuing bonds. When Dinosaurs Die, I would say if you're reading this to a child, make sure the adult reads it first because they touch on suicide and they touch on traffic accidents and murder and they touch on lots of different things. So just make sure that those are all topics that the adult is prepared to answer questions about. The Dead Bird, Margaret Wise Brown, who did Goodnight Moon, wrote this, and it's just really beautifully done. Other than inadvertently encouraging children to touch dead birds, it's very well done. The Rabbit Listened is one of my favorite ones. It's not about grief necessarily. It's about the value of listening. It has all the animals, and the bear wants to come in and scream, and the jackal wants to come in and laugh, but the rabbit just listens. Spoiler alert. But these are great books, and I would say if you're having trouble accessing your emotions about grief, sometimes kids' books are a good way in because they touch on some other parts of ourselves. My contact information is up here. I'm always happy to talk shop. You can always reach out. It'll be on there as well. And I'm going to leave the last, I talked a lot more, 17 minutes or so for questions, and these slides will be distributed, so folks will have access to all of these, as well as my contact information. So we have about 17 minutes, and what I want to acknowledge is this sort of energetic shift. You went from receiving information and sort of processing things, and now we're going to go to sort of more of a conversation, so just to acknowledge for your nervous systems that we're going to make this switch. And so this is an opportunity if folks have questions about what came up or how certain things may apply. I know a lot of folks like to share their stories, and we can bear witness to them, but I can't really do on-the-spot grief counseling. I'm not good at that. So I'm happy to bear witness and send you some love, but specifically if folks have questions about this or how things apply or what you should do, hit me up. I'm here. Yeah. Do we need a microphone? I think we do. I was told that we do. I thought I could just shout, but they said we need microphones.
Says it's on. Can you hear?
Yeah.
Does it sound like it's on? There it is. You talked a lot about, I think, because it applies to a lot of people here in terms of the caregiving and the fact that you start grieving, you know, whether it's the first symptom or the first test result and that kind of thing. How do you find it different for people who, for lack of a better way of putting it, are totally blindsided by what happens? I mean, almost to the point, obviously, my husband didn't just drop dead of a heart attack,
right?
But the time frame, there was no caregiving. I mean, I don't even know really what I'm asking is, other than is there anything different?
So,
a person
yeah, that's
can
a
do?
great question. The nature of the onset of the illness, I'm going to give you a clinical answer to what is, I know, a very painful personal experience. But what I will say is the research shows that the nature of the onset of the illness drives our own sense of that initial experience of it. Whether at the initial sense there's a high expectation of mortality or uncertainty or unknowing or powerlessness, but that initial encoding of that narrative has a huge impact on how we grieve. Right? So if in that initial diagnostic process where like you get diagnosed after somebody is so far gone that you can't even recognize or process with them, which I know happens so frequently, then the narrative begins with us being in this paralyzed, powerless, shocked state. And it is so hard to come out of it. It's like a trauma response. And so the nature of how it comes on is very different than you're a little forgetful here and you're a little forgetful there and then this thing happens, which is another kind of horror. I'm not comparing, but it's another kind of horror, right? And so the ways in which our nervous system can sort of drop into an empowered state will take longer afterwards because you're probably staying in a shocked state for a longer period of time. Does that resonate?
Absolutely.
Yeah. A lot of other people were nodding when you said that, so just please know you're not alone in that experience.
So you're saying you stay in a state of shock longer?
Yeah, without preparation. So preparation generally helps people approach stress sort of from like a metered up kind of thing. If people know something is coming, for most people, it creates a hyposensitivity. When it happens suddenly, your nervous system goes from here to here, and it creates a state of hypersensitivity, and so you just end up in a state of shock. The integration is a lot to manage when you're still doing all the things.
So for me, I got a diagnosis at 12 o'clock, and at 4 o'clock I put him in hospice, and he died 5 days later.
Yeah.
So there was no caregiving,
Right.
really. And I still think that after 2 years I'm still in shock.
Yes, that would make sense.
Okay.
How does that land for you when I say that?
That I'm still in shock?
Yeah.
Well, we were high school sweethearts. I got married 4 weeks out of high school. We were married 40 years, and so I'm still lost because the nights are the worst. I'm sure everybody has experienced that.
Yeah.
I don't know what to do next. Right. And it's been 2 years, and I think that people think I should be getting better.
Right.
I am better. I mean,
I hope you tell them to screw themselves.
What's that?
I hope you tell them to screw themselves. That they should screw themselves, or they think they should live. Sorry. This is New York style grief counseling. Yeah. This is New York style vigilante justice. Yes.
Some people are understanding.
Of course. It's hard to sit with the pain of somebody you love. It's hard to watch somebody you love suffer for 2 years, and they just want you to fix it and put a bow on it so that they don't have to suffer.
Yeah, I had a wonderful marriage, and I just don't know what the next is. I mean, I have retired, and I moved because we lived on a farm, and I wasn't taking care of the horses and all that.
Oh, do you know Earl? He's a farmer.
So I feel that I am still so lost.
Yes, because it's only been 2 years.
Yeah.
Yeah.
But I feel like I should be further along, and
No. I mean, I want you to have that comfort and that relief, for sure, but it's been 2 years.
yeah.
Yeah.
Okay, thanks.
Sure. You want to? Yeah.
I can kind of build on that. 2.5 years, I had a massive heart attack and nearly died because of my grief. So what I want to know is the self-care and, you know, the blessing of my heart attack was that I stopped my obsessive grieving. It was like that, I have to put the past, close that chapter. I can't change it. I can't bring him back. I can't, you know, I have to accept that it happened. I can't change the future.
Right.
And have anxiety about tomorrow, how I'm going to live tomorrow. I have to live for today, and I have to find my happiness. Because otherwise, the grief was going to kill me. It almost did. And so, yeah, 2.5 years, 2 years, whatever the number is, I wasn't, you know, leading up to it, yeah, I'd cry and I'd feel pain in my chest. Did I know I was killing myself, you know, with my heart? No. But that was, my question was going to be, when a life event shocks us out of our grief, is that good or bad? In my case,
Sure.
I felt
Yes.
like I had to accept the shock of the heart situation, the surgery, the whole thing, to be able to continue to live. Otherwise, it was going to consume me and kill me.
You know, there's so much that goes into the ways in which our bodies hold our stress. And as much as we would like to think that we totally understand and can say A cause B, the world and our bodies are complicated places. I have degrees in feelings. I don't have the answers for that. But I think recognizing that sometimes it takes a big life event that we say, nope, I got to do stuff differently. For most folks, it's about figuring out, when do I have the bandwidth to tolerate change? Because the first couple of years afterwards, it's just like, holy crap, what did I just go through? And what you're finding is stability. Because in order to change, right, in order to do this, you have to grieve and you have to let go of a lot. And you have to process a lot. You have to tolerate a lot of change. And the first couple of years after, you may not be able to tolerate that. You may be in a state of stasis. And if you're starting to feel like maybe I'm stuck, not just other people think I shouldn't be stuck, but you think like, wow, this doesn't feel right. This feels like off. Right? This is where a therapist can be really helpful. Somebody who specializes in traumatic grief and can do these things and can help you sort of figure out, how do I slowly increase my capacity to feel my feelings and let them happen, because I had to button them up so quickly before.
And to accept that you deserve happiness.
Yes.
Besides the fact that this crap happened in your life.
Yeah.
And that and the only way, you know, that I remember hearing people say, you have to want to be happy. And there's a lot to that. But part of it is, what do you deserve? You deserve happiness. For, you know, even if the person who passed would have wanted you to be happy and all those things and everything, but what do you deserve? We all deserve happiness, and we have to kind of get our path going down that route. And it's hard. It's very hard, and most people, I hope they don't come to a life event that shocks them into it like I had to go through.
And what I will say to add to that is, what you definitely all deserve from this moment onward is compassion. Compassion for yourself, compassion for what you're going through, compassion for what your process looks like. And if you get to a place of happiness and joy again, great. But if where you are right now is learning to be really gentle with yourself for exactly where you are, then that's what you deserve too, right? And that is a worthy effort. Thank you. Yes, in the back.
Thank you. My mom's been diagnosed with CJD about 7 months ago. She's still on the bed. It's come to a stage where, the end could be any time now. Our family, it's me, my brother, my father, and my grandmother, etc. We have sort of come to terms with accepting that it's going to come to an end anytime now.
Right.
Philosophically, we are able to understand that and capture that.
Right.
But the challenge that I specifically have is from the time when she was able to talk, at least to some extent, move to some extent. At that point, we did not know it was CJD.
Right.
But things happened so fast.
Right.
Within about a week or 10 days, it went from, talking, conversing to nothing.
Right.
And during this time, we never got a chance to tell her, hey, this is a terminal disease.
Right.
And I'm struggling with the fact that we never let her know and she could not express her final thoughts.
Right.
Every day I'm thinking about it. I am struggling to get out of that. I live here, she lives in India. We, over the last 6 months, I traveled a few times.
Right.
I mean, the care that she has there is incredible. Again, I think she's, we are extending her life and maybe she's suffering through that care.
Right.
We don't know about that.
But I'm hearing that the one of the pieces that you're struggling with, among many, is closure is a terrible term. There's no closure. That's not a thing. It's a myth. Surprise. But the things unsaid. This is what's happening. I love you. I'm sorry. I'm going to miss you. All the things that we would like to be able to say. The moment of understanding, clarity, and connection, that you two are grieving this process differently because you did not have time to grieve it together. There was not the opportunity to have that together.
Exactly. And
that is one of the unique natures of things that happen suddenly, right? Whether it's a sudden like a heart attack or a stroke, the CJD, whatever it is, whatever illness is that come on an accident, a trauma, right? Where there's not time to have the experience together, to sit there and say, hey, Ma, listen, this is what we're dealing with, this is what we're going through. Let's have a reckoning. And that's really painful, right? And to figure out, how do I hold space? How do I hold space for that wound, right? For that connection that I would have liked to have been able to have. On the one hand, I can use it to inform my other relationships to make sure that things are not unsaid with other people in my life. I can use it to look back at my relationship with this person and hold on to all the things that we are to each other and recognize that the gravity of our relationship is more than the last 10 minutes of coherence that we have with them, right? People are not defined by their last 10 minutes of being able to talk to you. It's an entire lifetime together. But a lot of it is figuring out, how do I take care of myself, knowing that this is something I'm going to carry, right? How do I make this a loving, gentle experience for myself, even when it's ripping me apart inside? Because there's not a way to fix this, right? We don't have time machines. I don't have a time machine. But yeah, when you were saying that, a lot of people were nodding, and I think that's a pretty shared experience for a lot of people in this room. Just went on with that. How does that land for you?
Repeat that, please.
I'm sorry?
Repeat that, please.
How does that land for you, all the things I just said?
Still unable to digest.
Yeah, it's a lot to digest. Yeah. Our brains want to search for, our hearts want to search for some answer, some closure, some process, something that we can do to fix this unbearable state, right? And it's a lot, right? Yeah, thank you for sharing that. I'm sorry. Yeah. I think there's up here if you want to walk it all the way up.
All I wanted to say is, when you try to figure out when you start feeling better. My husband died in 2016. We were married 37 years. We have 2 adult children. I had one granddaughter, and my grandson was born while my husband was in the hospital. And he did get to see him. Mm-hmm. But from the first signs to when he passed was 7 weeks.
Right.
And before that, I was caregiving because he had just had triple bypass surgery. So it was not known that it was CJD because they kept on telling me it was symptoms of
right.
the heart attack, which it had nothing to do with. But what I was trying to say is the first year that he passed, I kept myself super busy, and I had 2 grieving daughters and a granddaughter. So I was still caregiving them, and it didn't hit me more. I think I had a harder time the second year.
The second year is frequently much harder than the first.
And I find myself now that I feel I'm in a good place. I've had my sister helping, and things are going. I'm slowing down. I'm looking to try to retire soon, but I still have those moments. You know, I'm watching TV and something triggers, and I have this moment, you know.
Absolutely.
But I feel I'm able to calm myself and get back to a good place sooner. But it just, how many years has it been? 7 years.
Right.
You
Thank
know?
you for sharing that. You know, I think what you're describing is really important in that the grief doesn't go away. It becomes something you get used to, and it becomes something you expand around, right? When the grief first happens, I think it's like when you're driving a car, it's on the windshield. You can't see anything else. Everything you're doing is towards the grief, right? And there comes a point where the grief is in the front seat, where you're feeling it all the time, but some of your energy is still going in other directions, but still with you all the time. And for some people, then the grief goes into the back seat, where it's always with you and you feel it, but it takes a cue or a reminder for it to come to the front. And what I will say is that grief does not go to the back seat when you're done grieving or when you care less or love less. It's when you feel secure enough to know you can bring it back anytime. When you trust that you don't have to cling to it to feel the connection. And that level of security takes years, and that's okay.
I have one other thing to say. Because
Yes, our last comment, because then we need to stop.
Some of my relatives feel that it's really strange, and why do we do that? The answering machine is my husband's voice. And my girls have said, don't ever change it, because when I need to hear Dad, I call the house.
Beautiful.
When you're not there.
Beautiful.
And so I haven't changed it. It's still my husband's voice.
And all of you get to decide the ways in which you carry the person with you. And how do you carry them with you in a way that honors the fact that you're still alive and honors the fact that they lived. And that's going to look different for each person and different points in time. And I will say along those lines, which is a great example, if that sort of resonated for you, the book Invisible String might really speak to you, the child's book Invisible String. But that's a really beautiful depiction of healing from grief, so thank you. So it's 5 o'clock, so we have to stop. I am going to stay here for a little bit. I know we have like a break right now, so I'll stay here for a little bit just in case people have some questions or want to come up one-on-one. But I just want to take a moment to acknowledge the enormity of what we talked about over the last hour and give folks a moment to sort of settle back into their bodies and make that shift from processing their grief, organizing, being in touch with it, back into sort of social mode again. So just take a moment to acknowledge that, and thank you all for who shared and opened up and went through this experience together. And the generosity in this room is really beautiful. So thank you for letting me be part of it. Thank you, everybody.